Health Service. Okay. Committee, today, July the 25th. And first thing on the agenda is the approval of the last minutes. Supervisor Bruno, second by Supervisor Rooney. Any additions or corrections to the minutes? Okay, not to move on. All those in favor? Aye. Aye. Opposed? Carried. All right, next we have privilege of the floor and public comment. Is there anyone who wishes to make a comment? All right, I'm going to move right on to the business, and I'm going to start with you, Rob. Good morning.
Good morning.
Morning.
Okay, first item that I have is a resolution request to amend the 2023 Warren County budget in the amount of $134,054. And this is to allow for acceptance and pass through of 100% state aid. And this is both from New York State Office of Mental Health and the Office of Addiction Services and Supports. In the 23-24 enacted New York State budget, there was a 4% cost of living adjustment that was included for those agencies funded by these state agencies. And there's a table provided there that shows the various contract agencies that we have, a breakdown of the amounts and appropriation budget codes.
Would someone like to make a motion to bring that to the floor? Supervisor Nick Davis, seconded by Supervisor Runyon. Any questions? All right, all those in favor?
Aye.
Aye. Opposed? Carried. Thank you.
Okay, next item is request to transfer funds from unexpended fund balance to pay court ordered CPL 730 competency examination and restoration expenses. This is an item that's been a problem for us this year. Originally, we had budgeted 50,000 at the beginning of the year in this line, and then earlier in the year, I believe it was April, we did amend to transfer 300,000 to bring it total up to 350. But I included a table here as well that shows a breakdown. It's a little hard to see because the print is so small, so my apologies there, but you can see that we've had actually 6 individuals this year that have received these services from the state. And the chargeback to the counties, you could see the per diem underneath the table there is, it's over $1,000 a day for each individual. And generally, sort of the most typical sort of length of stay would be probably around 90 days, 60 to 90 days per individual, sometimes longer, sometimes shorter. But at this point, you can see out at the end of my table there, we are at a total, this is the incurred expenses of 483 and change. That includes both the chargeback expenses and then the items that are underneath that top table are examination expenses. We pay $200 for each examination, 175, I'm sorry, 175 for each examiner. And when we receive an order for a competency examination, it requires at least 2 examinations, sometimes 3. So that's what we've been incurred, expenses of 483 and change. The billing lags a little bit behind, so we're keeping track of what we're going to actually have to pay. We haven't been billed for all of this yet, but I'm just trying to stay ahead of it so when we receive the bills, we'll be able to pay them.
So we're actually looking for like how much money? I just wanted to be sure.
Well, I was going to suggest, well, I'm suggesting
I think it says 300,000.
yeah, I think I suggested a request transfer of an additional 300,000.
Okay.
I mean, I don't know if there's a way we could do it pay as you go kind of thing, see how it goes, or if it's just worth it to try to move another 300. whatever doesn't get used does roll back into the fund balance, so
Probably you're better off to do the 300, and if we don't use it.
it just reverts back, right?
All right, someone like to make that motion? Supervisor Ronan, second. Supervisor Bruno, any discussion? Yes,
How much money is in the unexpended fund balance?
And then I don't know.
I mean, you have at least the 300 then.
I believe it's,
go ahead, yes.
I don't know. Figure.
I believe it's 32.0.
Oh, we're plenty of money. Okay.
Yeah, no.
Okay, if there are no further questions, let's vote on it. All those in favor?
Aye.
Aye, opposed, carried, thank you.
And then I have a couple of informational items. I just wanted to keep the committee posted on our ARPA behavioral health projects. You know, the ARPA committee at Warren County had designated $1 million for behavioral health services and then some additional funding above and beyond that. So I just wanted to provide an update that that money is getting out into the community and being used for the projects that were approved. There's a little report in your packet that just details each of the projects and the funding advanced. So all of the projects, most of the projects are receiving funding and implementing their projects. The ones that aren't, have not been advanced funds yet, would be number 7, Glens Falls. They are expanding and relocating a crisis unit. And they had run into some initial delays, having to work with the state because they were going to have to decertify some inpatient beds, and the state did not want them to do that. So they have now found alternate space, and they're in the process of getting that space configured.
Yes,
This crisis unit, is that the one that involves the youth?
Yes. Both adults and youth, yeah.
Oh, okay, and they're relocating it to,
It's going to be some other space within the hospital. They have a 7-bed unit, and they were having a little bit of difficulty separating adults and youth. So they've identified some separate space that they're going to use for the adults, and then that'll leave the 7 beds for the youth.
just curious, I attended a meeting with the Vice President of Hospital, whoever.
Yep.
Back in January, February, regarding problems they had with the juveniles.
Yeah.
Where to house them, that sort of thing. Will this address some of that?
Yes, this will definitely address that. The larger issue is that, you know, youth will present to the emergency room, be found in need of hospitalization, and there's no beds in the state. So that's why they end up staying in the emergency room, basically, or now the crisis unit, for sometimes weeks at a time. So this creates better space for them, you know, more appropriate space, and they can receive treatment while they're there instead of.
It's like short term.
Yeah.
Yeah, thank you.
any other questions? Okay. We have a lot of projects going around.
Yeah, it's really good to see the money getting out and being used, these things being implemented. The other ones that are not yet funded are, there was an additional 111,000 that was designated for mental health and homelessness. And we've been working with the continuum of care. They're putting together a proposal for those funds. So we have not received that yet. So we're waiting to see what they come back with. And then there really wasn't part of our funding, it was just the county ARPA funding, but the 65,000 for mental health first aid. We're still working on, you know, implementing that, because there's a lot of different options for how that could be implemented within the county. So working with Jackie and Tammy as a little work group on that project. Any questions on ARPA?
Anyone?
It's, I don't think it's directly related to ARPA, but at the criminal justice meeting back several months ago, we had some discussion with Northern Rivers about them expanding their services, this for immediate response with first responders. Do you know if there's any movement on that at all?
You know, there's a little bit of movement on that in the sense that the state has changed some of the. They were running into some issues where if they were to implement overnight hours, overnight coverage. For them to be able to bill for some of those services, there were some barriers there. There were certain things they couldn't bill for. And the state has changed some of that. So I think the model itself now could should be more conducive to them being able to be sustainable, by doing that. However, the volume, we're still looking at the volume, whether there's enough volume of calls overnight to sustain, the expense of having, you have to have a clinician available, but you also have to, of course, have supervisor available, or at least on call, for that overnight period.
So it's fairly status quo.
Fairly status quo, but there has been that change in the regulation, the billing ability, so that could improve
All right, thank you.
the opportunity. Yeah.
Any other questions regarding the ARPA money? I think I have something else there, Rob.
And my last item is just the opioid settlement funds. I just want to provide an update on that too. I know that we have been receiving some of the opioid funds, and so we do have some of those now in the county. We have a process defined to start to look at how we're going to get that money out, because obviously we want to get that out into the community sooner rather than later. One thing we're doing is we're doing a survey of some of the provider community and the recovery community to see what their priorities are. Certainly within the approved uses, because all the settlements have a schedule of approved uses. And the state opioid settlement board also set their own priorities. So we're kind of working with those priorities, looking at what the local priorities are, and then figuring out if we also looking at internal county needs, are there departmental needs? Does the sheriff's department have expenses related to opioid that fits within the approved uses? Maybe the health department, things like that. So we're going to be kind of surveying some of the internal departments as well to see if there are departmental needs. And kind of try to put that all together. It's a little bit confusing because there's different pots of money, and some of the settlements are front loaded, so some of the money there's larger amounts, like for the first few years, and then it trails off into smaller amounts. So I'm also working with Julie Butler in purchasing as to how we sort of do that, because the settlement funds will go out for an 18-year period total. And then there's a cliff, so it drops off, So we're kind of looking at, would that mean, RFPs every maybe 4 or 5 years to redo them, or are there projects we want to sustain the entire period? So it just makes it a little bit complicated, but I just wanted to let the committee know that we're working on it and trying to figure out how to get those funds out, sooner rather than later.
But we appreciate that information. Any committee member have a question for Rob?
You know the amount of the funds we received so far? Just out of curiosity.
Yeah, I didn't bring my table. It's somewhere around 200,000 something. But again, that would be the county funds, and then the offices of community services also receive some funding through Oasis, that's settlement funds, and that's probably around 200,000. So we were somewhere around 400,000 for this year.
Thank you.
But that also included last year's funding together with this year, so.
Very good. Thank you.
Thank you. Anyone else with a question? All right, thank you, Rob. Keep doing a good job for us, and we appreciate that.
Thank you, Rob.
Thank you.
Thank you.
All right, Dee?
Morning. So the first item on my agenda is permission to enter into a contract with Pure Foods, which is Mom's Meals, to provide meals to seniors in Warren and Hamilton counties at a rate of $7.49 a meal, not to exceed $5,000. We had started a contract with Mom's Meals back in 2021. And we added 2 people on in Lake Luzerne who had specific dietary needs. So these are the 2 clients that we're keeping on with Mom's Meals at this time.
So would someone like to make that motion? All right, Supervisor Garachi, seconded by Supervisor Bruno, any discussion? Right. All those in favor?
Aye.
Opposed? Carried, thank you.
The second item is permission to amend the county budget to accept COVID funding received for the vaccination of homebound seniors, which will increase our revenue and then budget codes. So we received about $35,800 to vaccinate the homebound population for both Warren and Hamilton counties. Unfortunately, we received the funding a little bit too late. We received it after public health had already vaccinated these populations. So we got permission to purchase certain items with this funding. So that's what we have done. We had to do it by a certain date. So we're asking permission to put the monies into contracts. Even though it's going to be to purchase items because we had to do a journal entry to move it from contracts to supplies. So we're putting it back where we got the money from. So that's kind of why it doesn't jive a little bit with where we're using the money.
Thank you. Someone like to make that motion? Supervisor Runyon, seconded by Supervisor Bruno. Any discussion? All right, all those in favor?
Aye.
Opposed? Carried, thank you.
3 and 4 kind of go a little bit together. Their permission to enter into a memorandum of understanding and a business associates agreement with the St. Lawrence County Health Initiative. The memorandum of understanding is permission basically to deliver evidence-based programs to seniors of Warren, Hamilton County, and the business associate agreement is permission to basically be part of their coalition, so that we can help promote the program and participate in their meetings. There is no cost to do either of these,
All right, so we can put 3 and 4 together then.
if that's okay with you guys.
Okay, so would someone like to make that motion? Put this 2 together, Supervisor Bruno, seconded by Supervisor Runyon. Any discussion? All those in favor?
Aye.
Opposed? Carried, thank you.
And then just for informational purposes, as the county administrator mentioned on Friday, we did start our contract with the Salvation Army to provide meals to the seniors of Glens Falls and Queensbury. Again, started July 3rd. The Salvation Army took over the Cedars meal site. It's been going very well. We haven't had any complaints so far. Knock on wood, we won't have any, but that went very well. Seniors are enjoying the meals. Most of the staff transitioned to Salvation Army. We had one that stayed on with the county. She's up at the Warrensburg meal site, but things are going well.
Right, I'm happy to hear that when I think how long it has taken us to get to this point, where we worked out something that made life a little easier for your department. So I'm glad we finally got there and now we seem to be going along smoothly. So thank you. Any questions from the committee? Yes.
Maybe just an observation or state of kind of how we're doing when it comes fundamentally to homelessness and people having enough to eat food. Are we okay, Warren County? Would you say
As
generally?
far as homelessness,
Homelessness as well as, people
Yeah.
having enough to eat.
the homelessness, I can say, I believe that has increased, but that's across the board. As far as having enough to eat, we've actually seen a decrease in the number of seniors that are getting the meals out of our program. But we're providing it to anybody that does qualify for it. And then the congregate sites are open, so people can come in and get the meals as well. And for the congregate sites, that's open to people that are under 62, but those individuals are required to pay the $7 a meal, but they can get the meals too. But yeah, I mean, I think we, the Office for the Aging, are meeting the needs. Unfortunately, with the homelessness, that across the board has increased, unfortunately.
Thank you.
Hey, could I just ask you a question?
Yep.
The people that receive these meals, do they get some kind of information saying to them, this is how much you could contribute toward this meal? Because I find we don't have a lot of people up by us, but I just find they seem to think it's like a free service and they don't donate anything. I have like one person who does, and I just wonder if something goes out that says to them, you know, any donation that you can make toward this meal would be appreciated. Do you have better luck down at this end for giving money?
It depends on the community, and throughout the year too as well. But when people initially sign up, we go over that with them, that they can make a voluntary contribution if they want to. Anybody that's over 60, it is voluntary. They are not required to. Anybody under 60, it is required. But of course, if it's a home delivered meal, they have to be 60. We don't provide home delivered meals to people over 60. That's part of the program. And then throughout the course of the year, we also have little envelopes that go out with the meals, that says, you know, you can provide a donation if you want to as well. The suggested contribution for those above 60 is $3 a meal. We've kept that consistent. We have not increased that, especially at this day and age when the cost of everything has gone up, because we know they can't afford much. But again, it is voluntary. We don't require that.
Thank you. I was just wondering. Did anyone else have any questions? Thank you kindly. We appreciate all your hard work, and I'm glad the Salvation Army program is going.
Yes. Thank you.
You're welcome. Yes.
Yeah.
How are you?
Oh, okay. Oh, thank you.
For you.
That's the annual report. Here's our agenda.
The only one we got is just which is we just got a healthcare bonus check from. Okay. So I had to quickly have that. All right. A lot. This people, so.
Sure. I do.
Do you have more copies? Thank you very much. Good morning, ladies.
Good morning.
Morning. Hope that for you are.
We all set? Good morning, everybody. Good morning.
Morning.
Just three things for today. The first is to authorize the Director of Health Services to award WC 42-23 transportation for preschool children with disabilities and or the early intervention program in Warren County to the lowest responsible bidder, and authorize a contract for a term commencing September 1st, 2023 and going through August 31st of 2024, with potentially 4 additional one-year extensions with authorization to negotiate up to a 5% annual increase or decrease for each renewal period. This request for proposal transportation, the deadline was July 18th. Warren County needs the contract in place by September 1st to ensure that our eligible children in the preschool program and early intervention program have transportation to get to their programs. There was only one response. It was Duran, who's our current vendor.
Right. All right. Someone make a motion. Supervisor Bruno, second by Supervisor Bennett. Any questions? Guess if you only got one response, you don't have anything to return, right? All right, all those in favor?
Aye.
Opposed? Carried. Thank you.
The second one's kind of a nice thing. It's just to accept our 2020 annual report Each year, Health Services prepares an annual report to document our programs and trends. This report is also a reflection of our dedicated and amazing efforts of the entire Health Services staff to ensure these services are available and to promote the health and safety of our community. I really want to sincerely thank each and every one of our staff members for their efforts.
We need a motion to accept that, right? Someone would make that motion, Supervisor Bunyan, second by Supervisor Brenda. Any discussion? Right, all those in favor?
Aye.
Opposed? Carried. I will tell you, I've only made it like halfway through, but there is a lot of information in there that's kind of perfect to say, wow, I didn't realize this, or I didn't know we were involved in that program. So I do hope you make the effort to read.
And if anybody has any questions, they're free to reach out and we'll be happy, or like a tour of our department or anything. I'm happy to do that. The add-on resolution request number 3 is to amend our 2023 budget to reflect the New York State healthcare worker bonuses, and I will turn it over to Ton.
It's attachment number 8. And basically what happened is Friday, we got a check for a healthcare bonus. It was for 2 people. It was the total of $3,229.50. So I just have to amend that department 4196 of the code to reflect out those revenues that we got. So it was for 2 people for 3,000, and then the FICA and Medicare expenses that are related to that. That's all.
So would someone like to make that motion? Supervisor Durante, second by Supervisor Runyon. Any discussion? Right, all those in favor? Aye. Opposed? Carried. Thank you.
Continue.
Then attachment number 3 is our financials as of July 11th, when we had to do this. You will notice that our salaries down below, again, we like to note that we're at 34.77. This was as of July 2nd payroll. 34.77% of the budget and 49.31 last year. One thing to always note is the fact that our overtime and part-time salaries have gone down. A lot of it was related to COVID and having part-time people and contact tracers. Overtime, of course, if needed. So that went down. Attachment number 4 is our comparison between last year and this year. One thing I want to just mention is under equipment and contractual expenses, which is supplies. Our ELC school grant ends next week, the 31st. So a lot of what's in the equipment line, and I mean, most of it is equipment that we had to buy for the schools, and also then the supplies we had to buy for whether it was PPE or supplies for that. Today, for example, we are getting a Tomcat. It's a riding thing for the floor to clean. That's getting delivered to Johnsburg School today. And that is not reflected here yet, but that's over $14,000 just for that. So, and then there were other things that they got some equipment that they needed supplies to run those equipment. So all of that will be done as of July 31st. So that grant will be over with. Revenues again are reflecting, I did a cruise for WIC for May, just basically continuation of where we stand. And I'm in the middle of finishing the next quarter of billing for all our grants.
And then we have our other attachments. If anybody has any questions, and just worth noting with the rabies attachment is our rabies clinic schedule. And that's all I have.
Ooh, that was a short one. Is there any committee member that has a question? I want to just go back to 24 minutes. Under contractual, like 2022, it was like 5 million. Now today it's 2 million. What comes under contractual?
Contractual are all our expenses except for salary, equipment, and fringe benefits.
Okay.
So pretty much everything else, supplies, postage, phone bills, rent, everything else that is covered under.
Thank you. No questions? Anything else to report to us, Janelle, or are we good?
We are good. Hope everybody has a nice rest of the summer.
You too. All right, oh, I guess at this point, I didn't think what we can do. Bruno, second, all those in favor?
Aye.
Thank you. Thank you for that.